Well, thank you everyone for joining us this evening. My name's Lori Marie Peixoto, and I'm the Executive Director of the Mental Health Association of Rhode Island. Welcome to our first Grassroots Advocacy training for this legislative session. We're very excited to have you here. I'd like to introduce my co-host for this evening, Karen Malcolm. Karen will be presenting with me. She comes to the Mental Health Association with a wealth of experience in community organizing and advocacy, and we're very lucky to have her. The legislative session is gearing up. Undoubtedly, there will be many bills relevant to the mental health community. MHARI and our partners will testify on many of them, and that's great. We have many champions at the State House, but we really do need you, the voters, to participate as well. So that's why we're here tonight. We want to talk about how you can best engage with your elected officials to make change at the state level. And so without further ado, I would like to review the agenda. First of all, I'll let you all know that this session is being recorded. We will place it on our YouTube page, and we will also email it out to you after tonight's session, along with a handout and some other information. So we will begin by providing an overview of the Mental Health Association's highest priority bills. We will talk about how a bill becomes a law in Rhode Island. We'll talk about exercising our grassroots power, tips for talking with elected officials, how you can help organize in your own circles. We'll have a Q&A period at the end, and then we'll talk about our next steps. And if you have any questions along the way, please feel free to raise your hand, and either Karen or I will call on you, because we want this to be interactive and hopefully fun and interesting. So let's stop with these top priority pieces of legislation. So the bills that we will discuss tonight are bills that were developed by the Mental Health Association and partners like Rhode Island College, for example. There are many important bills that will be introduced this legislative session, including many important items in the governor's budget. And we will be happy to send you information and action alerts about those bills as well. But these are pieces of legislation before you that Mental Health Association has had a hand in some way. And so that's why we're talking about them tonight. If you have not already done so, please subscribe to the Mental Health Association's newsletter so that you can be kept abreast of action alerts and information about legislative matters and how to sign up for testimony and so forth. And you'll be able to sign up for that newsletter on the bottom of our homepage. So first of all, we have a bill that was introduced last year. It's a bill that requires commercial insurance companies like Blue Cross and United Health, Tufts, to increase their outpatient behavioral health provider reimbursement rates. And we are also calling for the same increase on the Medicaid side. This bill was introduced last year. It passed the Senate floor, but it stalled in House Finance, and a mirror bill stalled in the House Health and Human Services Committee. We were very disappointed that it didn't pass last year, but we're hopeful we can get the bill passed this year. And why is this important to mental health consumers and providers? Because we know that when insurance companies and Medicaid underpay behavioral health providers, the result is that providers leave the field, or they practice in Massachusetts or Connecticut, where the reimbursement rates are higher, or they change jobs and go to a better paying opportunity whenever it comes along. So then that creates a high staff turnover in private practices and community mental health agencies and so forth. And the shortage of staffing, of course, creates wait lists for people like you and me who might want to see a therapist or a psychiatrist or a psychologist. So that is why we've introduced this legislation. We've asked for an increase that is actually based on research. The Milliman Research Group studied reimbursement rates across the country. And in Rhode Island, we know that our outpatient behavioral health providers are reimbursed 23.4% less compared to their colleagues on the medical side of the plan. So we're asking for that modest increase just to bring them up to parity with their counterparts on the medical side of the plan over a period of years. So this legislation will be introduced again. We do not have a bill number at this time. The sponsors are tinkering with the bill a little bit, and they plan to introduce it, I think, in early February. So that should be out soon, and we'll let you know. So that will be sponsored by Representative Teresa Tanzi, most likely also a version on the House side by Representative Robert Craven and Senator Joshua Miller. The next bill was developed in collaboration with Rhode Island College's mental health counseling program, and I see some of our colleagues from that program are here tonight. The bill would create two-tier licensure for mental health counselors. And this follows suit with 40 other states in the country that have this two-tier licensing structure. The first tier would be considered an associate counselor, and they would be allowed to take any kind of insurance. Currently, with the one-tier licensing structure in Rhode Island, until a counselor is fully licensed, they can only bill Medicaid when working with clients. And so that means that there are clients like you and me on wait lists who could see a mental health counselor if only they could accept our commercial insurance. And so this legislation aims to correct that problem and increase access to care for people like you and me who are on wait lists right now. So this two-tier licensing structure should be noted that it's parallel to what's currently in place for social workers. So we weren't really reinventing the wheel or doing anything radical. We're just making the process equitable between counselors and social workers. So Representative Kathleen Fogarty is sponsoring it on the House side, and Senator Alana DiMario is sponsoring it on the Senate side. The next bill is, again, working with Rhode Island College, but this time it's with the School of Social Work. The first bill eliminates the entry-level licensing exam for social workers, which has been found by social work schools across the country to have racial bias that causes students of color, students who speak English as a second language, to fail the test at a rate that's far higher than their white counterparts. So all of these students are gaining the same information, taking the same coursework in their social work schools, but the students of color are failing the exam at a rate that's out of proportion to their white counterparts. And every time they have to take that exam again, it's over $200 per test. So some other schools across the country are considering doing this. Illinois actually just passed a law that eliminates this exam. The state of California never had this entry-level exam. And it should be noted that this is the only licensing requirement that changes, that we're proposing to change for social workers. So everything else would stay the same. The number of credits that they have to accomplish at Rhode Island College. The number of supervised hours remains 3,000 hours. The second licensing exam after they complete their field work, that remains the same. So the only difference is that we're eliminating or proposing to eliminate the first entry-level licensing exam. And that is being sponsored by Representative Shal Cross and Senator Alana DiMario. Next, we have another piece of legislation for the School of Social Work at Rhode Island College, which would require the second and final social work licensing exam to be offered in multiple languages within 5 years. Because again, we know that students who speak English as a second language don't do as well on the exam, and we want to give them a fair shot. So this would give the companies who make these exams and offer these exams, 5 years to offer the language in multiple languages, to offer the exam in multiple languages, pardon me. The last piece of legislation we're working on in collaboration with the Women's Fund Policy Group in Rhode Island. We may have a few folks here tonight from that group. We are working with Senator Sandra Cano, who introduced exciting legislation last year that passed the Senate but did not pass the House. So we are going to find a sponsor on the House side. And the bill that we are trying to pass would create minimum qualifications for school psychologists, and it would establish the scope of their practice within schools, and it would establish state funding for school-based mental health services. We know that 50% of all lifetime cases of mental illness begin by age 14. And we also know that young people's mental health has been profoundly affected by this 2-year pandemic. And so having more school mental health professionals would certainly help these students who are showing symptoms of a mental health challenge. It would help them be identified earlier, get into treatment earlier, and have improved patient outcomes. That's why we feel so strongly about this legislation. So these are our top priorities. These are the bills that we have had a hand in some way or another. And again, we'll be sharing other bills that are not discussed here tonight and items in the governor's budget, but that will come at a later time.
So I think that hands it over to me. That's a lot of information. So what questions do any of you online right now have about that set of bills that Lori just very briefly reviewed? And if you raise your hand, then I'll be able to see you. Seeing no hands raised.
I have my hand raised.
Oh, sorry, Charlie. I recognize your voice. Why don't you go ahead?
I'm a little confused. It seems like you want to make it easier to become a social worker, but harder to become a school psychologist. I'm not understanding that.
Thank you, Charlie. No, we're not trying to make it harder to become a school psychologist. I think the legislation needed to be clarified, and that it would, in fact, improve the possibility of having school psychologists in schools and would clarify their role.
And I think most important, Charlie, is that it would establish a state funding mechanism, hopefully beyond Medicaid reimbursement, to ensure that we have an adequate network of school-based psychologists.
Mm-hmm.
Is that helpful?
Yeah.
I think one of the important things about this particular set of bills is that in our survey of Rhode Islanders about what was most necessary for people to better access behavioral health services, overwhelmingly, the response we got was, we need more professionals, right? Like I can't get an appointment. We need a stronger network of providers across the full spectrum of qualifications. And so I think that this particular set of bills, given the capacity at the Mental Health Association to lead on a certain set of bills, and like Lori said, there will be many other pieces of legislation, is that they address building an adequate network of mental health professionals through increased reimbursement rates via Medicaid and commercial coverage. And our professionals are vastly under reimbursed by insurers, whether they are Medicaid MCOs or commercial insurers. It eases access into licensing and certification for new professionals coming out of college, particularly a more diverse representation of providers through counseling and licensed clinical social workers. And it addresses the need to increase funding for school-age children. So it kind of hits multiple areas. And I know this sounds really weedy and complex, and as constituent advocates, that can make it hard sometimes to talk to our legislators. And hopefully along this agenda, we're going to try and help make that a little bit easier. The main message within this particular small set of legislation is to increase the number of behavioral health professionals we have in order to build a stronger continuum of care.
And can I add one thing to that?
Yes.
I've heard numerous times people say that they're seeing a certain provider, they have a good relationship with them, then the person gets a better job elsewhere. So they have to start all over again with someone new, and that can be very traumatic for someone who's in the middle of treatment to have to start all over again with someone new.
Exactly. I mean, that's one of the major issues that people experience, and it disrupts their care, and it can put somebody into a downward spiral. And so some of these pieces of legislation, although they sound complex, are really targeted at trying to deal with some of these problems. So I know that many of you probably are aware of how a bill, the basic components of how a bill becomes a law. I'm not going to go into a lot of detail here, but Lori and I both thought it was important to understand sort of how that happens in the Rhode Island General Assembly. And to also understand that at pretty much every point in the continuum of drafting a bill, through getting a bill signed into law, and then even once signed into law, getting it implemented properly, there are important moments where advocacy is needed and necessary. We're going to focus primarily tonight on sort of around between bill introduction, the committee hearing, and hopefully maybe getting a bill to the floor. So, but there are multiple moments when advocacy becomes important. And so in Rhode Island, typically what happens, although it's not required, is that a bill gets introduced in exactly the same language on both the House and the Senate side in our General Assembly, the Rhode Island General Assembly. And so that's why on Lori's bill chart, and you're going to get a much more detailed copy of that bill chart as a follow-up to this meeting, there's typically both a House bill number and a Senate bill number. We seek out sponsors who care about our issue and are willing to champion them. And we work typically with them to draft that legislation. They take that legislation to their leadership and to the Legislative Council, to the General Assembly, and the bills get written and introduced. Once they're introduced or on introduction, the bills get assigned to a committee. Sometimes we have to advocate to make sure that the bill we're working on gets assigned to what we think is the correct committee. Sometimes healthcare bills get assigned to the Finance Committee, who isn't necessarily thinking holistically about the bill as a health bill and only looking at its cost, right? And in that instance, we might want to advocate with leadership and get the sponsors involved to get that bill assigned to the Health Committee. That as an example. So bills get introduced into committee, and then typically we sit around and wait, and we get all of a sudden notice that that bill is going to be heard in a committee hearing. Because we have bills introduced on both the House and Senate side, that means we have the opportunity for testimony at 2 hearings on the same bill. A hearing on the House side and a hearing on the Senate side. we often only have short notice, 2 days, 3 days, to notify all of you that, hey, hearing's been scheduled, be ready, we need you, this is the moment. And so that's why we're trying to be proactive in helping advocates be ready for when that moment arises. This is a critical moment, not only to educate legislators, particularly the committee members, but also to educate the broader membership of the General Assembly and the public, because in Rhode Island, our committee hearings are broadcast over Capitol TV. And there are a lot of Rhode Islanders that follow that. And so this is an opportunity to help build an understanding among other constituents, as well as our elected leadership, about the issue that we're talking about. If we're lucky, the committee passes the bill out of committee and it goes to the floor of the chamber. So if it's the Health and Human Services committee on the House side and they vote passage, it goes to the floor of the House. If it's the Senate Health and Human Services Committee and they pass it out of committee, it goes to the floor of the Senate, each on their own. At that point, it's another important moment for advocacy. This is where every single member, if it's going to the House floor, we need to get the votes we need on the floor to get it passed. And that's where everyone calling their own state representative is important. If it's going to the floor of the Senate, that's the moment when that phone call to your own state senator becomes really important. Then, if even luckier, we get it passed in both the House and the Senate and it looks the same. Now, again, sometimes there's a lot of work that has to be done here because amendments may have been made to the bill that passed on one or both sides, either the House, Senate, or both, and they may no longer match up. And so sometimes we have to help advocate during negotiations between the House and the Senate in order to do what they call reconciling those two separate bills and getting them so that they can each pass. The Senate can pass the House version and the House can pass the Senate version. Then if we're lucky enough to make that happen, and it does happen, otherwise we wouldn't be passing laws in Rhode Island, then it goes to the governor to sign into law. I think truthfully on the bills that we're talking about, if we're lucky enough to get it to the governor's desk, I bet it's gonna get signed, but that isn't always true. We saw this past legislative session that the governor actually did veto several pieces of legislation that then the House and the Senate had to go back and override that veto. So that is a possibility. So that moment from passage out of the General Assembly and its delivery to the governor's desk, we need to, again, it's a moment for public education and advocacy to weigh in with the governor to say, this is on your desk, sign it. Once all of that happens, bill becomes a law, then we're into a whole other phase of implementation, which we can talk about at another time, but those are the basics. The truth is that with any bill, and in any state, or if we're talking about the federal government, often a bill that starts as an apple ends up as an orange because of amendments to the bill, changes to the bill, the reconciliation process that might happen between various members of the General Assembly and the executive branch. Our goal is to try and advocate for the legislation that we helped draft, keeping it as close to apple form as possible, and achieve a win on behalf of Rhode Islanders and their access to behavioral health care. So that's a little bit about how a bill becomes a law. Are there any questions? I see Lori has her hand up.
Thanks, Karen. I just wanted to mention a tip. Even if I'm testifying verbally in a committee, I always submit written testimony as well, because written testimony becomes public record. And then members of the public, legislators, and even the governor and his or her staff can go back to that public record and read through all the letters supporting a piece of testimony. So my verbal testimony might be very brief, but I can go into greater detail and I can cite evidence and studies and research in my written testimony. And then if it does pass the committee, General Assembly members can go back and look at what was submitted in favor of that in the committee. That's just a tip.
We'll talk more about that. But are there any questions at all about these sort of advocacy moments that we have? And that doesn't preclude just the need to establish relationship with your own state rep and senator. In Rhode Island, honestly, it is all about relationships. It's about you putting as a patient, as a provider, as someone with lived experience, or as a student entering newly into the profession, you're an expert. And our elected officials actually work for us. It takes a lot for us to win change. And the truth is that a phone call, an email, or a letter can make a big difference, even outside of that bill becoming a law process that I just went over. So what's the first step? I know most of you on this call know this, but the first step is to make sure you know who your state representative and state senator is in the Rhode Island General Assembly and how to contact them. So I'm going to stop share here for a minute, and I'm going to switch to a website, which we're going to provide you the link to, but it's Open States. I tend to prefer the Open States tool to our own state-based tool, just because it's a little bit easier and they give you a bit more information. But online at openstates.org, they have a tool for you to find your legislators, and you literally just look up by your address. I'm going to use a random address here. So I'm typing it in and I'm going to search. And this is an East Side, Providence on the East Side address, an 02906 address. So it shows me Rep. Kislak is in the lower house, which is the house, the lower chamber. The upper chamber, being the Senate, is Samuel Zurier. Shows the district numbers, both my state rep district number and my state senator district number. And it also shows me my federal representatives in US Congress. So Senator Reed, Senator Whitehouse, and Rep. Cicilline. For our purposes, we're talking about our state folks. If I click on Rep. Kislak, then what it shows me is her official email address at the State House, her web page on the General Assembly website, as well as a phone number that I can try reaching her. She also has a PO box number that you can snail mail a letter to her at if you choose to. She's pretty responsive to her email. Rep. Kislak is an ally of ours. She's very responsive to her emails. And so there you go, that you can use that email address and reach out. One thing when reaching out to folks is to always ask them to confirm that they've received it at least, if not respond to the statement or message that you're sending them. So that's a little bit about, that's one tool. We also have our state tool. Lori is going to be emailing everybody a handout from this meeting that includes more detail about the pieces of legislation she talked about, as well on the backside, links to lots of information about General House and Senate rules in the General Assembly, how to look up the links you can use to look up your state rep and senator. But But that's the first step. And especially if you are helping, for instance, a neighbor or a friend who may not know who their state rep and senator are, these are links that you can provide them as well. So what are some of the kinds of things that we can all do together on legislation to try and win passage? Well, like I said, so much of it is about relationships. So, you know, you can visit your state rep and senator in person at the State House or even in district. You know what? Rhode Island is one of those places where you can actually run into your state rep or state senator at the grocery store, at church, taking a walk in the local park, taking your dog to the dog park. It's amazing how few degrees of separation there are here in Rhode Island between us and our elected officials. But you can formalize that by reaching out and maybe asking for, in these COVID days, maybe a telephone chat. Make sure you know you tell your state rep and senator that you're a constituent. You can testify at a hearing orally. It's one thing to submit something in writing. It carries much more power if you testify in person. You take the time to do that. Lori's going to talk a little bit more later about how to do that. Write a letter to the editor of your local paper. My bet is that both your state rep and senator are reading the local paper. Kent County Times, the East Bay Times, whatever, Providence Journal. Write a letter to the editor of your local paper and be specific about, you know, I'm writing because this bill number such and such, that would do such and such, is up before members of the General Assembly. I support this legislation. Here's why. So a letter to the editor of your local paper can carry a lot of weight. And you can also send a copy of that letter, use that as your first email or first outreach to your state rep and senator. Just call them, pick up the phone and dial the number, their contact number, and try and get a telephone conversation with them. Send them an email. You can take the letter that you've drafted it as a letter to the editor. If you're not comfortable doing a letter to the editor, just put your own story into an email and send it to them. And you do not have to wait for a hearing. You don't even have to wait for the bill to be introduced to start this process of building relationship with your state rep and senator on the issue of building an adequate network of behavioral health care in our state. So those are some grassroots actions. Do other people have ideas on actual actions that we can all take together? And there's obviously much bigger things that can happen and that will be happening as we progress through the legislative session, and that will keep you apprised of things like, you know, press conferences or rallies, lobby days at the State House that Lori's going to talk about later. These are some of the things that you can do right from your own dining room table, kitchen table, living room couch. And I want to make sure if I'm missing anybody, speak up, turn mute off and speak up, because I can't see everybody while I'm screen sharing.
Well, you can make a contribution to your legislators' campaign. That gets their attention.
Yes, that we can't, because we're a C3, we can't really talk about that, but that's a very good point, Charlie. Finally, one of the most important things that you can do is help organize others on this issue. You know, if you're a member of a support group, if you're a student in the School of Social Work and you're got a lot of other friends who are also students of social work, if you are a patient and you have family members who care about this issue, you have a neighbor you know has been struggling, talk with them. One of the most empowering things is just to take a simple action, like send an email or write a letter. I noticed that Monica has raised her hand. Monica?
Hi, thank you for the overview. I really appreciate understanding this more in depth. I've been involved with MHARI with the bill that's related to the two-tier licensing with mental health counselors. So my question is, I'd like to understand for that reason, but more broad. I'm a little concerned in the early part of the bill writing or kind of like describing what it is we're asking to be written into the bill for the mental health counselors, for example, to correspond with my legislators now, because I get concerned that kind of like what wording I might use now is not as polished as it will be soon. So I guess my question, if I boil it down, is it better to start soon with small messages and build as we go? Or if you have any suggestions along that line, please.
That's a very good question. Thank you for that. Yeah, I think it's very important in the early stages before we've developed very polished talking points, which we will continue to provide all of you. Lori's going to be sending out a bill chart with some basic information following this meeting, but we will be developing, and she will be working on, in partnership with others, much more polished talking points as the legislation progresses. But right now, even just keeping it simple and straightforward. I'm a student of social work at Rhode Island College. I'm going to be working in the behavioral health profession. It's important, there's going to be important pieces of behavioral health legislation coming to you as part of this year's legislative session. I'm hoping that we're going to be able to count on you to support some of these important pieces, and I intend to follow up. It would be great if I could schedule it, if we could find a time to chat for 10 minutes, so very simple. I wouldn't get into any detail. We don't even have bill numbers yet on all of these pieces of legislation. So I think if you're gonna tomorrow, and I would encourage you to send sort of an introductory email about who you are, what you care about. You care about strengthening investments in behavioral health care and strengthening our network of behavioral health professionals in the state, and that you're going to be working with other advocates and the Mental Health Association on that. And you hope that they're with you on that. Like, even just that is a very good first volley to them in terms of building relationship. Is that helpful?
It is. I think I was trying not to commit too much to detail, and you helped me see that the beginning piece can be small. So I do live in a small town where I am apt to run into the folks that I'd be writing to. So thank you. I appreciate that, Karen.
Great. And so you can do some of this with others. You don't have to do it alone. And inviting others, even if it's just one or two other people. Hey, you want to sit down and, write a letter together? We're in the same district, or read, proofread each other's emails or letters to our state reps and senators. You can also, depending on how many relationships, how connected with your own neighborhood and community is, help to organize an in-district meeting where and again, I think this is something that would happen later in the session, and this is just an example, but where you might be able to even just bring together 4 or 5 other neighbors who live in the same district and schedule a Zoom meeting, or if we reach a point where we can do things like this in person, organize an actual in-person conversation for several constituents and their own state rep and senator. So those are some of the kinds of things that can happen. And some of that, it really isn't hard. It's people to people, person to person, neighbor to neighbor kinds of things that are what it takes to get a bill passed in Rhode Island. I'm turning it over to Lori if there aren't other questions about those kinds of actions that that exemplify how we make stuff move in the General Assembly. I'm going to turn it over to Lori for some more tips and tools on specifics about talking to elected officials.
Thank you, Karen. That was fantastic. So the first thing I'll share is that for those of you who do not know me, I tend to be a shy person. And even today, even though I've been doing this work for a while now, I still feel nervous sometimes when I'm talking to legislators or other elected officials. So I share that with you just to say, take a breath and realize that our elected officials are just regular people like you and me. Some of our legislators are teachers and mental health professionals and nurses and doctors and attorneys and professors. And while I think it's natural to feel a little bit of nervousness, just remind yourself that they're just like you and me. Just take a breath, take 2 or 3 breaths if you need to, and then proceed with a phone call or testifying in a committee hearing. I'll also say that if you're ever asked a question, I mean, legislators, especially in committees when they're listening to constituents, they tend to listen more than they speak because they want to gather information. They want to hear your experience and the information you want to share with them. But if they did ask you a question and you don't know the information, it is totally fine to say, you know, that's a great question. I don't know the answer off the top of my head, but I will look into it and I will get back to you. And then, of course, follow up with them. So it's totally okay to say, I don't know, if you actually don't know something. I'd also share, be specific. So let them know what bill or if there are more than one bills, if there's more than one bill, let them know the bill numbers that you're talking about and state very explicitly, I support or I oppose this piece of legislation. When it comes to the bills we're talking about tonight, I encourage you to say that you support them. You want to give your name and your address so that they verify that you are in fact one of their constituents. You want to talk from your heart about your own lived experience, or if you're there because of a family member who's had an experience, you want to talk about how the experience or the hardship or the issue at hand has had an effect on you or your loved one. I think when you do that, I think that's the most powerful thing we can do as voters, is to share our own stories as opposed to just giving data and just giving facts and just giving statistics, because humanizing the issue and talking about it in a way that makes it real and relatable, that's where you really can have a powerful effect on a legislator. And all the more so if you happen to be one of their constituents in their district.
And I would add to that, the fact that public policy in the form of legislation gets so in the weeds, right? Like it's like, what? We're talking about insurance, what? We're talking about licensing, but the impacts of those pieces of legislation have real effect on real people and on us. And that's what I think is hard for legislators to bridge the gap on, right? On controversial issues, it always comes across, right? But on some of these issues that have been hidden for so long, like so much around behavioral health has been held back for so long, that to understand how not being able to get an appointment with a mental health professional, right? Or find a mental health professional that is compatible. That's a big deal when someone is really struggling. And that's like saying, no cardiologist available, sorry about your heart condition, right? And in behavioral health, a lot of this has been, bubbling, but not coming up over the surface. And I think it's important that this year, especially, we do all we can to try and bring this forward as a human issue, and that these seemingly weedy pieces of legislation actually will make a difference for people.
Thanks, Karen. Yes, That Karen's 100% right. So we're talking about policy, but take that policy and make it relevant to your real life and your real experience. Don't worry about numbers and statistics and looking up research and data. They want to hear from you about your experience and your hardship. Lastly, if you're speaking one-on-one with a rep or a senator, end your conversation with, will you vote yes on this bill? And see what they say. And if they say, I'm not sure, I would need more information, you could say, sure, is there anything I can do to help you get that information? What specific information are you looking for? And then either you or you can take it back to the Mental Health Association, or we could work with our partners, but we could help you find that information to satisfy your rep or senator's curiosity or need for more info.
And I would definitely, if they ask for more info, reach out to Lori Marie and or me, and we will get you what you need. Oftentimes, legislators will deflect by saying, I need to know more. And if you push them a little, well, what information do you need then? Don't worry about feeling responsible for finding that information. Email us and we will help you get what you need to follow up.
Thanks, Karen. Next slide, please. So, as Karen mentioned, one of the most powerful things you can do as a voter is to actually show up and testify at a hearing. Now, right now, during the COVID pandemic, we believe that they will still have in-person committee hearings, but we're not sure. But we will definitely let you know as hearings come up if you can testify in person, or if they're giving us an option of in-person versus telephone versus Zoom. So we will let you know what your options are as we learn them ourselves. And when we send you action alerts, we will include instructions and the links to register to testify. Because if you're testifying on the phone, or if they have Zoom, you will need to testify on your computer. If you're testifying in person, you sign up in the committee just before it begins. So you'll sign up in person if you're testifying in person. If you're testifying electronically or on the phone, you'll sign up on your computer, and we'll let you know. So you will sign up to testify. They usually do first come, first serve. The sponsors of the bill speak first, and then they just go in order of people who've signed up. So if we have 100 people testifying, it could be a long night for some of us. So I always try to sign up as soon as possible. I would suggest practicing your testimony to make sure that it's no longer than 2 minutes, 2.5 minutes at most. Because if there are a lot of people to testify, first of all, they will cut you off and kind of rush you through your testimony. But also because they really want you to be concise so that they can get on with the evening as well. So rather than wait for them to cut you off, I would just be prepared to speak for 2 or 2.5 minutes. I think the best way to prepare verbal testimony is, instead of writing a script that you would read, which they tend to tune out when you're reading, instead write just bullet points of your testimony. You can even do it in an outline form if you wanted to, but either an outline or bullet points of your testimony. So it forces you to speak in a conversational tone, to be natural, as opposed to reading a script. When you're called to testify, you would just simply state your name. If you're speaking as a voter, or if you're speaking on behalf of an organization or another entity, you would state that. You would say, I support bill number such and such, or I oppose bill number such and such. And then you go into your testimony, but you want to be very clear, the bill number and your stance on it, whether you're for it or against it. And again, as Karen mentioned, share your own story about why the bill is relevant to you. Don't focus so much on the weedy parts of the policy about licensing requirements and exams. I mean, you can mention that, but really the bulk of your testimony should be how it affects you as a mental health consumer, as a mental health provider. So that's what the bulk of your testimony should be about. And then at the end of your testimony, you want to say to the committee, I respectfully request that you support this legislation, or I respectfully ask that you vote yes on this bill and pass it out of committee. But you definitely want to end your testimony with a specific ask that they pass the bill, or if you were opposed to something, that they would oppose the bill, but you want to be clear about that. Karen, do you have anything to add?
I would only add, and I know we're going to have a second follow-up meeting where we can talk more about this. In the handout that Lori is going to email to everybody, there's a link to a real easy template for using to help outline testimony. We know in the conversations with the sponsors that it's not likely. Well, we're trying to make sure that the hearings happen at least after their February break. They have a break in February, so we're keeping our fingers crossed that we don't have a hearing pop up too early. But also at committee hearings, there's more than one bill that they're going to be taking testimony on, and because we have a part-time legislature that only meets for about 6 months out of the year and only typically in normal times, 3 days a week. These hearings can get the agendas can get quite hefty. So you might be signing up to testify in person, either over phone, Zoom, or at the State House itself, on one bill for a meeting where there's, 20 bills being heard. So patience is required. It might be that you have to sit and wait a while. It's just a reality of how our legislature in Rhode Island works. So be prepared. Have your coffee or tea with you. Make sure you've had a snack or a bite to eat. And just come knowing that you may have to sit for some time and wait for your chance to be heard, but it's important. So it's worth the wait.
I'll mention that when we can testify in person at the State House, in the past, I would bring a big bottle of water. I would pack my dinner. You're not allowed to eat in the committee rooms, but you can eat in the hallway at the State House. And I bring my laptop and I work because they do have free Wi-Fi at the State House. So you're able to get some stuff done while you're waiting in line to testify. And again, show up early so you sign up early. The higher you are on the list, the sooner you'll be called. And as Karen just mentioned, they have hearings and they meet at the State House typically Tuesdays, Wednesdays, and Thursdays from January through the end of June. If you wanted to speak with your rep or senator before they go into session at 4 o'clock, I would advise you to get there around, 3 o'clock, 3:15 to try to catch them on the floor in either the chamber for the House of Representatives or the chamber for the Senate. But that would be where you would find them if you were trying to steal a few minutes of their time without booking a meeting with them. You can ask to book a meeting with them, but if you just wanted to show up and try to catch them while they're preparing to go into their session, you're welcome to do that as well.
I see that Louise has her hand up.
Hi, I just have a quick question. In the past, I testified a few times, and what happened to us was we ended up being in the end, and most of the committee would be gone. We end up with like 2 people left sitting there to hear us speak. Is there any way to alleviate that?
Sometimes it's possible for the paid advocates to work with the sponsors to try and get our bill higher on the agenda. What I would say is that for those legislators or committee members that don't stay for the full committee hearing, one, it doesn't negate the fact that you've taken the time to get there and to testify in person. That still does have an impact. Demonstrating the power around an issue is as important as all of the testimony combined. Your testimony still is entered on the public record. And as I mentioned earlier, these hearings are broadcast on Capitol TV. And so other legislators and members of the public are watching. So what you're seeing happening in the hearing room may not necessarily truly represent the elected leadership and members of the general public that are being impacted by your testimony, if that's helpful.
Yeah, thank you.
So I see our time is growing short. I wanted to give everyone an opportunity to ask any questions that might be lingering. Okay, so hearing none, I just want to mention what we anticipate our next steps to be. So we would like to have a follow-up training session with you on February 22nd on Zoom at 6 p.m. It'll be a very similar format to this. And that training session will focus on helping you craft compelling testimony to your reps and senators.
So this gets to Monica's question earlier. On February 22nd, I think we will be much further along. We'll have bill numbers. We may have more highly crafted talking points and specific messages that might be helpful to you. And we thought we could take, a good 20 minutes of this 1 hour meeting on the 22nd to help people walk through the template for putting together potential testimony.
Thanks, Karen. And then in honor of May is Mental Health Month, NAMI will be providing a free Advocacy Smarts training, and it will be in late April. The date has not been set yet. And NAMI and MHARI will also collaborate again this year on a policy briefing. So that will also probably be late April or maybe early May, but you'll hear about that from us. And then we always kick off May is Mental Health Month at the State House, and we're hoping to do that this year on the State House lawn, just to be extra cautious and avoid any cancellations due to COVID. So the proposed kickoff date is April 28th, and the event will begin 1:30. But if you just wanted to attend for our lobbying day, that will begin around 2:45, 3 o'clock on the same day. So we'll have the event for May is Mental Health Month. We always honor a couple of legislators, usually a representative and a senator, who've been champions for mental health in the previous legislative session. So we'll give them awards. We'll have speeches from consumers. We'll talk about the most important issues of the day. And then around 2:45, 3 o'clock, we will all file into the State House. We'll have to go through the metal detectors, but then we will file into the chamber for the House of Representatives and then the chamber for the Senate. And we can provide seating charts so you can find your reps and senators and you can go right to their desk on the floor and chat with them. So it'll be a group lobbying day. You won't be alone. You'll have the support and collaboration of everyone else, and hopefully we'll have a very big impact for the mental health community. So that's all we have for you tonight. Any other questions, comments, suggestions, inspirational quotes?
Ways to improve this. We called it a meeting. We really want people to feel comfortable in weighing in. And we hope that we can build, a goal is to have a really strong grassroots team that's willing to work together to see some substantive change in this legislative session. I'm seeing some stuff come up in the chat, people saying thanks. But if you have thoughts on how Lori and I can improve these meetings and make them more engaging, that would be great. And we really hope that people can join us on February 22nd, because I think we'll have bill numbers at that point, be able to talk more on messaging and talking points. And You know, maybe by then some of you will have begun the process of building relationship with your state rep and senator and can share your experience in that regard.
Well, thank you all. We really appreciate your taking the time out of your busy day to be here and to be willing to be an advocate for the mental health community. We will be in touch. We will send you a follow-up email in the next day or two. It will have the link to this recording on YouTube. It will have the handout we've talked about, which will have links and a link to a template and so forth. And we'll also have a registration link for the February 22nd meeting. And again, please sign up for our newsletter so you can be kept abreast of all the upcoming activities and events we'll have going on in the next few months. Thank you all very much.
Thanks, everyone.
Have a great night.